and I'll be your speechtherapypd.com host for this podcast series entitled Converging Careers Interprofessional Practice for Speech Therapy. So a bit of background, I've always kind of been at the junction of different fields as an SLP and a musician and a CogSci research coordinator. So it's really a passion of mine to try and bring together incredible insights from different fields in order to show how they might make our work as SLPs more effective and sometimes just to be wowed by the beauty of science. So I truly can't think of anyone better to do that with than today's guest, Dr. Nina Kraus. Her work as a neuroscientist focusing on sound and how our life in sound creates our sonic world is incredibly relevant to our work as SLPs, and I'm super excited for this. So just a little background on Nina so you know how much of a rock star she is. Dr. Nina Kraus is the director of the Knowles Hearing Center and professor of communication sciences, neurobiology, and otolaryngology at Northwestern University. And as a biologist and a musician, she thinks about sound and brain health. Her research has found that our lives in sound, for better, in the case of musicians, bilinguals, and for worse, as in the case with concussion, hearing loss, language disorders, and things like that, shape how our brains make sense of the sounds we hear. Her book, Of Sound Mind, How Our Brain Constructs a Meaningful Sonic World, was written for the intellectually curious, and it's fantastic. Dr. Kraus advocates for biologically informed choices in education, health, and society. And if you have time, please check out her website, www.brainvolts.northwestern.edu, and we'll add that in the notes after. Before we get started, just a few items to alert you to. This course is 1 hour and it will be offered for 0.1 ASHA CEUs. A financial disclosure is that we each receive a small honorarium from speechtherapypd.com. Dr. Kraus is the author of the book Of Sound Mind, which we'll be discussing in part today. And just a couple of non-financial disclosures. She's also the director of the Knowles Hearing Center, as I mentioned, and professor of communication sciences at Northwestern. So without any further ado, so excited to welcome the amazing Dr. Nina Kraus. Thank you for joining us.
Hey, thank you so much, Garrett. I really look forward to our conversation together.
Me too. And I know we'll get into the weeds as far as sound and the brain and language disorders and all of that. But maybe we can start. Can you tell us a little bit about yourself, maybe your superhero origin story with regards to your work with sound in the brain?
Oh, it just evolved. No superhero origin. I was born into a household where more than one language was spoken. My first language is Italian, and also my mom was a musician, and so there was sound and music all the time, and I must have somehow maybe realized that sound was very important. When I went to college eventually, I majored in comparative literature. I knew some languages. I like to read. And then I took biology and I thought, oh, this is fun. And at that time, I discovered a book by Lenberg. And he wrote a book called The Biological Bases of Language. And I thought, ooh, connection. This is possible. And so I eventually went to graduate school and got a biology degree to think about sound and to understand the biology of sound. I started out doing work on single neuron responses. So I worked on a phenomenon called two-tone suppression in the auditory nerve this was in the chinchilla. And, it's kind of fascinating to me that, if you play two tones together, what they do to the neural response is you can't predict it from the response of each individual note by itself. So, there's this combination, which is something that, of course, happens and with sound. And I remember explaining all of this to my mom, la mamma, and she was kind of scratching her head and saying, what are you doing? And I realized at that point that I could talk to maybe 16 people in the world about two-tone suppression, but that what was important to me was actually I wanted my mom to know what I was doing, and I wanted to be doing something that anybody at some level could understand how I was spending my time. And I, soon afterwards, again, I kept recording responses from individual neurons in animal models. But what I did is I moved to studying learning. And so, what I did is I taught an animal that a sound had a meaning. So if you played a sound, and so you have the same neuron, the same rabbit, and the same sound, what I was able to see is that once the animal learned, once a sound to meaning connection was made, and the animal learned that every time that sound happened, some kind of reinforcement was going to occur. I could see right in front of my very eyeballs that that the neuron's response changed. Same cell, same sound, same animal, and yet when the animal was naive, you got one kind of neural response, and then when learning happened, you got another. And in many ways, I have been looking at this phenomenon ever since. We now most of the work we do is in humans, and it's informed. We still are informed by our animal models, but
Still chinchillas?
no, guinea pigs.
Okay.
Yeah. And so I moved from chinchillas to gerbils to guinea pigs. But really most of the work is in people, and what really interested me, so again, our past shapes our present, right? Because as a scientist, I wanted to have the kind of precision that you have when you're measuring the response of an individual neuron in people. And of course, that's complicated to do in people, but there are ways of measuring sound processing in the brain. So one of the things that I have spent a lot of my career doing with my group, which is just, science is at least the way I do it is a collaborative enterprise, and the people that I have been working with, we've been working together with many of us for decades, so
it's like a musical group.
Yeah, exactly.
It's like a band.
Yeah, very
That's
much.
great.
So our lab, Brain Vaults, has really developed ways of measuring sound processing in the brain, built upon research done all over the world. And so chapter 4 of my book of Sound Mind is called The Quest, and it explains the journey of how we figured out what I think is a clinically viable, and in fact it is clinically used, way of measuring sound processing in the brain, and a way that is important in that it tells us information across populations. So we can average data, look at kids on the autism spectrum and compare them to typically developing kids. But we can also, because I want my cake and I want to eat it, is we can also, because clinically it's really important, the individual is, who we care about. And so this measure, which is the frequency following response, or FFR. In fact, we just had a big workshop on it in Chicago. I wish that you could have come, Garrett. You would have loved it. It was one of the few meetings I've ever been at, and I'm no stranger to meetings and conferences, where the clinicians and the scientists were really listening to each other. We were all on the same team. And so really my view is that knowing how a person responds to sound, and with tremendous granularity and objectivity, can inform clinical practice.
Right. Yeah. And if nothing else, I think that right there is such an important point for all of us, as clinicians, to think of ourselves on the same team and to really listen, because I think we do tend to, kind of get sucked into our own little world, and maybe we have the stuff that we learned in grad school, and that becomes like just what we ride on for the rest of our careers. But there's so much going on, like you mentioned, and this book is full of, I'd really just implore everyone listening to really check it out, because there's some awesome things that are quite practical for clinical work and diagnosis, intervention, all of that stuff. Yeah, and it, one of the coolest things that I remember from the book is you're talking about the FFR, the frequency following response, and I'm not sure if this is the same thing, but you mentioned in this book that we can, when we hear a sound, our brain has some response to the sound, and you can actually take that response and play it. So you have this version of Hard Day's Night that's actually not the original recording, but the brain's neural response in sound, and that just totally blew my mind. I was wondering if maybe you can expand on that idea.
No, I think it's important, because we're using sound to study sound. And, so of course, as I'm talking to you now and to anybody who is listening, the neurons in our brains are producing electricity. And we can capture that electricity, because electricity is the currency of the nervous system. And in the same way as right now, there's a microphone that is picking up my sound waves, the molecules that are bouncing around all around me, and changing them into into an electrical signal that then can be fed through our speakers. We can take the electrical activity that is generated by the brain, and we can play that through the speakers, and we can hear what the brain sounds like. And there are lots of examples. If anybody would like to listen, on the homepage of our website, there is a lecture that I gave before the pandemic at the Kennedy Center. And there are a number of examples of hearing people's brain responses, including, and you will like this, Garrett, because we have what we call the brain keyboard, because we not only want to hear how speech happens, but we also want to be able to measure. What we do is we measure the brain's response. Like I could take your brain and measure your brain's response to every single note on a 3-octave keyboard. So then I have those samples, and I can put them into my little keyboard, and I can play your brain, and I can hear how your brain sounds compared to my brain, or compared to somebody who has a hearing disorder or a language challenge. And it's you say, well, a picture tells 1,000 words. Well, listening and hearing, tells you a billion things at once.
Yeah, this is so incredible. And for the therapist listening, you probably agree with me that one of the biggest challenges is really knowing, we have all these diagnoses, and we see so many kids that come in, and after a while you do develop intuitions about what's going on, but it's really hard to tell, what exactly is it, the physiology of the mouth that's making it difficult to articulate sounds? Is it something about the hearing? Is there something going on with the brain? And we don't know. But with this methodology that you're putting forward, it actually allows us to see or visually and hear the response and the different responses. You bring up one example in your book. I think his name is a moniker, Danny, with dyslexia. And then you're noting that you can, look at his response to a single syllable and show that it was different every time he heard that syllable. And that, indicated that there was, something going on with his ability to, his compromised ability to process that sound, and therefore compromised ability to make those sound to letter mappings. And so I think this is just really huge for therapists, and really revolutionary.
Yeah. And if nothing else, so the FFR can give you a lot of detailed information, but if just as a clinician, if it was my kid, I would want to know yes or no. Is this brain processing sound in the way I would expect a child of whatever age and sex to be processing? Just yes or no. And it's just as important to you have a kid on the autism spectrum, and you might find that in fact he's processing sound as well as anybody, and so okay, well, this is not a bottleneck. On the other hand, so what you can do with the FFR is not only answer yes or no, which is huge, because, a parent, a therapist wants to know, is there a biological reason that this child is not hearing sound the way you would expect him to? And so just having that yes, no, and it helps with placements and in school and whatever, but it really helps in just thinking about managing a child. But then, with the FFR and with sound in general, Garrett, that sound is complicated, and it has a lot of ingredients, right? So, if you have a visual object here, it's got a size, a shape, a weight, color, and it has all these ingredients. And nobody appreciates sound, first of all. It's so underappreciated because it's invisible, and we're living in an increasingly visually biased world. But if you think about it, and so I'm asking everybody who's listening, think about sound, and you'll soon think about ingredients like the pitch, the timing, the timbre, the phase, the loudness, and there are all these things in sound that make it what it is. And so, for example, a child on the autism spectrum, one of the processing problems that we see often is that the child has difficulty processing pitch changes. So, for example, if I'm asking a question, the pitch of my voice goes up, and if I am making a statement, it goes down. So, just measuring the brain's response to yeah or yeah. A typically developing kid will follow every cycle of that pitch change beautifully, and you can see it automatically. And some kids, not every kid, but you want to know which kid, some kids on the autism spectrum just don't process those pitch changes. And so you know that at least part of the bottleneck is that they're missing how you mean it. Like they might understand the words you're saying, but they don't understand. Are you asking a question or making a statement? Are you mad? Are you unhappy? All of these things, these nuances in our tone of voice are so important. And I think we're losing a lot of that, I must say, parenthetically, in our visual world and in our technologically rich world, where an emoji is just not going to give you the information that the tone of voice will give you. And so in many ways we're forgetting how to listen, and I think that's true of us as a society.
Well, I wonder if this, during the pandemic, there's this huge uptick, 110% increase in communication disorders. And one thing I noticed as well, and I don't know if therapists have seen this too, who work in the homes, but to me, it seemed like there was an increase in the noise from technologies like phones and computers and TVs it was always on. So there's, always this kind of, if there's signal to noise ratio, let's say there's this tip in favor of noise. And so you're getting a lot of decontextualized speech outside of interpersonal interactions. And, I wonder do you think that this has an effect on kids who are learning to process sound and attach meaning to sound, and who are starting to, not find that human speech is irrelevant in some cases? Do you think that might have an effect?
Oh my goodness, I think it has a huge effect, and I think it has a huge effect. I mean, and I think the younger you are, the more vulnerable you are because your system is developing. But for all of us, I think that we are all, as a people, becoming more and more like machines. And I see this even in the way science happens. I mean, my students they never insisted on wanting to know, tell me the answer. There's hardly ever an answer to a complicated question. It's all pretty much always, it depends. And context really matters. And, thinking about this, but when you're dealing with technology, and, of course, I my work depends on technology. So, I think it's a matter of using it judiciously. But when you are interacting with technology, the way a computer forces you to be, you have to make a choice. Do you, press 2 if you want blah.
Yeah, I was wondering if we could I agree with that, definitely. I was wondering if we could back up and maybe talk about how, we aren't exactly computers. And this is in relationship to the sound mind. Maybe you can describe a little bit more about what exactly you mean by the sound mind, and maybe talk a little bit about how, it's our contextualized, embodied experience with sound and our lives in sound that sort of that changes us. I think that was something that we might have glossed over for people, but I think it's a really important point to bring home.
Yeah, and it's a very much of a core of the book, in that, when we think of hearing and sound and the sound mind, depending on your field, as if you're an auditory neurophysiologist, some people will look at the ear, some people will look at the brain. And if you just do a Google search for auditory pathway, you'll get this classic auditory pathway from ear to brain. And what you don't get, but which is true biologically, is the fact that sound will engage, making sense of sound engages how we feel. So it engages our limbic system. It engages our hormonal system. It engages how we think. So what we know, if we know that a sound, I'm expecting to hear somebody who has a certain accent. I'm predicting that accent, and you kind of get used to it. All the things that influence how you hear sound. So that's, and how you move. So how you move your articulators, how sound itself is movement. There is thinking, feeling, moving, and feeling includes also our viscera. We talk about our brain, but our brain is also connected to our gut. Have you ever wondered why, when you're in an airplane, sometimes food tastes kind of off? And people have noticed this, for years. And what they thought was that it was the dryness of the air that was affecting people's appetite. But scientists got in there, they did some very good science, and they discovered that it wasn't the dryness of the air that changed people's appetites, it was the sound. Because, sound evolutionarily is our alarm sense. And at some point we also should talk about noise, because noise is a pernicious force in our world, and our world is getting increasingly noisy. But so you have this noise of the jet engines, right, that's going on, and here are our bodies that have evolved in a certain way to react to sound. And who's hungry when you hear an avalanche coming?
Right. So I could stop blaming the airplane chefs, is what you're saying.
Yeah. But I speak of the sound mind as engaging our cognitive, sensory, motor, and reward system. And by sensory, I also mean how we connect with our other senses. So the interactions that we make with vision and hearing and all of that. But that is one big sound mind. So you can think that the sound mind engages so much of the brain and so many different processes, which is why sound is, of course, at the nexus of language, because language also engages many of these things. And so, as any speech pathologist will know, sound, and it's making sense of sound. I think that historically there's just been, the idea of, rule out hearing loss. Okay, fine. But most of the kids with language problems have perfectly good ears, but it's a processing problem. And the processing problem can come from the many, many, many different things that make up the sound mind. So yeah, and the long version of that is in my book, and I speak very conversationally in the book. So it's not you don't have to be a scientist or an expert. My editor at MIT Press asked me, who's your target audience? And I told him Hermione Granger, because, this is a high school kid who is interested in the powerful forces in our world. But what I have to say is, again, my poor editor was shocked when I sent him my first draft, and 20% of the book was references. So, if everything that I say, I'm saying it conversationally, but it is I'm a scientist, I'm a biologist. It's backed up by the best science that has been made by scientists all over the world for a long time. And I think that that's really an important part of the message. So, the fact that the hearing brain involves our cognitive, sensory, motor, and reward systems is something that is very informed by tons of science. But, people haven't necessarily put it all together in the way that that I'm thinking about it, and that I think is really, really relevant to clinical practice.
Absolutely. Yeah. Thinking about, the ways that I sort of, when I was reading the book, I sort of thought about how it was almost like our brain creates this pair of glasses for our ears that, makes certain things sharp and other things a little bit more blurry. You use a great metaphor in the book of mixing board. So the brain's tuning up the different ingredients of sound based on your experience with that sound. So one cool thing for all the therapists out there to know that we might have glossed over is just that there's a two-way, there's two pathways, one going up towards the brain, the afferent pathway, and then the efferent pathway going back down towards the ear. And so these interactions are changing how we default process sound. I think you mentioned this, just for everyone who's not used to hearing about this. I think you can think of, hearing your name when you're sleeping. Usually you like tune out everything else. But if I heard Garrett when I was sleeping, I'd wake up right away. And,
even if you didn't wake up, your brain unconsciously, if I had electrodes on it, your brain would respond to those sounds, because you have learned over years that this is a sound that's worth paying attention to. So you will respond. And yes, there are these many pathways. And some scientists spend their whole career studying one subnucleus of this enormous pathway, and there's so much to keep a person
it's incredible.
Busy
it's so
for
cool.
a career. But there are pathways that go up and down and sideways. I wrote a very short article. It's just 400 words. It's published in Hearing Research, and it is you can download it. And another thing I want to mention is this marriage of art and science. So you'll find in my book of Sound Mind, I worked with an artist, Katie Shelley, and there are 80 original illustrations, because art is science and science is art.
They're really cool.
But they picked one of the pictures, one of the drawings that Katie made for the cover of this particular issue of Hearing Research that published it's called the Beams hypothesis, BEAMS. And B stands for brain, and E is for the efferent pathway, and this is how we learn. We are informed by the sound to meaning connections that we make. A is the automatic afferent pathway that we learn over time. This is what responds when I say Garrett and you're sound asleep. So BEAM, that makes our memory for sound, S. And what are we? What are we in terms of our sonic cells, if not our memories? So this is the Beams hypothesis. And it I think encapsulates this idea of efferent and afferent and upstairs, downstairs, and crosswise.
Yeah. And it's just, I think one reframe is that I talk to a lot of parents and sometimes therapists too, and there's not a lot of emphasis on how experience affects sound and language. And, a lot of parents, they sort of think that language is just supposed to come out. It's supposed to grow like hair or teeth or something. It's just, why isn't it happening? But there's really, all of this rich stuff going on in the environment, the child's experience with sound. And people have probably seen the TED Talk, Birth of a Word with Deb Roy. He does this huge home video. He records like tens of thousands of hours of his own home video, and he shows how many times his baby boy had to hear the word water before he was able to produce it. It was like 17,000 times across different contextual environments. And so like these, learning words happens over very long time scales, but it results from this like really important experience that we have that's always contextualized. And that was something that I thought was another kind of reframe of how to think about how kids are learning language. It's really experiential.
Really experiential, and also, interpersonal, interactive. Especially during the pandemic, people were walking by on their phones with their kids in their stroller, and I wanted to just shout, talk to your kid, don't talk to your phone. Even if you're walking your dog, I mean, it's rude to your dog to just be on your phone,
Right.
So, and think about what is involved, read to your kid. You take your kid, he's in your lap. And so, he feels the warmth of your body, you feel the cuddliness of his body. And you're looking at something together and you're talking about it, and he's reacting and you're reacting to what he says. And it's just this back and forth, kind of what McGilchrist calls betweenness, which is this wonderful interaction that happens. He kind of sees it as a way of contextualizing the world, but I see it, very much in the context of sound, is that, sound connects us. Sound connects us, and it's so important for language and language development and emotional development, our mental health. I think that people are less and less connected because, we're not as connected as we once were to our communities. And there's a tremendous increase in mental health problems. Like and all my students, will tell me, I'm stressed, I'm anxious, I'm lonely, I have difficulty focusing, and this is disconnection. And one of the things that just has to do with sound that I just at least want to mention is noise. And I define noise as unwanted sound. And it is often foisted upon us. Sometimes it's very necessary, sometimes it's not. And again, I think we can really think about how our sonic environment, if it's really noisy and distracting, if the TV's on, we don't have a TV, but if the TV's on when you're reading to your child, it's going to get in the way of his learning language. But then that's something we can do something about. So just kind of thinking about things like that. We have a lot of choices to make.
And that's a really practical and easy thing that we can tell our parents, is, just to maybe have one thing on at a time, if anything at all, because I see a lot of homes that have, if not 2, 3, 4 devices all running at once with different kind of noise going on in the background. And so it definitely is, we're sort of migrating into this digital world that is devoid of what you were talking about before with the, the really rich connection. And what I think is so cool is that we know this as therapists, that we know that interpersonal interaction makes language emerge. And your research is kind of elucidating why, the emotional reaction that you get from being with somebody is being attached to that auditory input. And there's nothing richer than having an interpersonal interaction.
And that's why we need speech therapists, speech pathologists. We need people. Yes, we can use computer programs for as a supplement for learning some particular thing, but actually being in a room with a child as a person, and I make this point even in my book with respect to science, is that so in my book you'll read a lot of or you could hear the audiobook, but then you won't get the pictures. You'll hear a lot about my family. And so there are lots of personal stories. You'll hear about my husband, who's a musician, and my 3 kids, and various experiences with sound that I've had over the years, because I think it's important that we think about science. Science is yes, it is this objective means in many ways of knowing things, but it is done by people. And we have to remember this personal part. And as therapists, I mean, what you do as a therapist, as a person, is a huge part of the therapy.
Absolutely. Yeah. Maybe speaking of therapy, do you have any sort of practical things that, based on this, are there some practical things that we could talk about for therapists to do? I know, one might take us down the, my passion of music down that road. But do you have anything that
Well, let's
comes up?
go down that route, because it's, everything I know scientifically and personally is that is that music is a wonderful way of strengthening the sound mind. And we know there's a lot of science to back up the ideas that that kids who have language delays have difficulty with certain rhythm skills. And so, you learn a lot of it because there's rhythm in language, but it's very explicit in music. And so if you can learn rhythm through music, that will help you with language. We did some studies a number of years ago. I was approached by founders of music programs, one in the gang reduction zones of LA and the other in Chicago Public Schools. They came to me separately and they said the same thing. And they said, our teachers in all of our different schools, they all know that the kids who make music are the better students. They have better language skills, they are better communicators, they're writing better. So we already know this. But Nina, what is going on in their brains? And so we embarked in years and years of longitudinal, well-controlled studies where we measured kids' responses to sound, largely using the FFR. And we also measured their reading skills and their ability to listen in noise, because a lot of learning on the playground and the classroom happens in noisy environments, increasingly so. And what we were able to show, well, first of all, what we didn't show is both in Chicago and in LA, we didn't see any fundamental biological changes after a year of regular music instruction. And so that was a hard phone call to make to the founders. But they, they believed in the importance of music and how it changes us, must change us biologically, that, they said, let's keep going. And so we did these studies for 2 years, 3 years, 4 years, in some cases 5 years. And what we were able to find is that the kids who made music, their brains respond to the nuances in sound, especially they respond to the harmonics in sound. So the harmonics are what distinguish one musical instrument from another when they play the same note. So you can take a tuba and a flute and you can play middle C, and it will sound different because in those two instruments, because they have different harmonics. Well, a lot of people know that. But what a lot of people don't know is that it's the harmonics that distinguish the difference between bad and dad. So the the onsets, the format transitions, which are sweeps and frequency, FM sweeps, these are harmonics. And the kids, one of the things that that happens in the neural response, the two ingredients that are especially strengthened by making music are the harmonics and timing cues. It's really important to know when meaningful things stop and start, and all the timing that happens in between. Many timing cues. So, we were really able to find that there were robust biological changes, and, there's nothing the kid could do to change his brain response one way or another. In fact, we measure what the kid has become based on their experience with sound. And so often they're sleeping, or they're watching a video while we're recording their brain responses. You mentioned that study that we did in Chicago with the Hyde Park Day School, where these are kids. So all of the kids that I was talking about before in the music programs in New York and in Chicago and in Los Angeles were largely drawn from underserved, economically disadvantaged populations. The Hyde Park Day School is kind of another end of the spectrum where these are school systems that have a lot of resources, and they had FM listening devices where the teacher wore a device that carried the sound of their voice directly, wirelessly to a cute little ear thing that the students had. And one of the things that it really helped with is, so it didn't amplify the sounds, but it made it more salient. So the sound, the child knew what to pay attention to. And so what we were able to do is we measured, and this was within 1 year, we measured these kids' responses, their FFRs, at the beginning of the year, and their responses, as you said, Garrett, were really inconsistent. So, if we measured the response to a syllable like da, 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 the brain's response should be reasonably consistent. But if the child, if their brain is responding in a different way every time the same sound happens, how are they to learn? So this was very much a characteristic we saw in the kids who were poor readers in the Hyde Park Day School. And by the way, we've published almost everything that I'm talking about in various journals. So you can read the studies if you'd like. But then at the end of the year, so we had one classroom, one group of kids, because they had different classrooms, one group of kids who were wearing the device, and then a group of kids who were not wearing the device for a whole academic year. And so they were taught by the same teachers in the same classroom. And then at the end of the year, we measured everybody again without the device, and we could see that their brain's response to sound had changed. And the kids whose responses were very wobbly and inconsistent at the beginning of the year, only after listening through this device, this assistive listening device, their responses automatically just became much more stable. And guess what? Their reading scores and language skills got better. So that happened. But let me get back to music, because music is really underutilized and under-recognized as a way, because it doesn't cross over for the most part into speech and language clinics. I mean, I'm trying to do this. I'm at Northwestern University. We have speech and language clinics, and I've been for years trying to have music be a part of the 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 the, the therapy, and there are, various ways of going about doing that. One thing is just to make sure that that the kid is making some kind of music. It doesn't have to be. It can be a music therapist, but if a child is just getting some music instruction, that's a huge help. And there are various approaches, and you said you had this beatboxing program, which it just sounds great, because with the beatboxing, it's your speech, your hearing as you're talking, all of these things, the sound mind is all engaged, and you're improvising. And what musicians are really good at is they're really flexible, which is why they're so much fun. And so you have this flexible mind that helps with everything, including language.
Yeah, and now that you're making these connections so clear for us, I think one thing that was a barrier was, for a lot of other SLPs, I'm not sure, but for me, at least in the beginning, I mean, I love music, so I was always trying to sneak music in, but it felt like sneaking something in, because I was like, oh, is this evidence-based? Is it not? Am I supposed to be doing this? So now that we have this like very clear connection, I think hopefully it will empower people to do what they already kind of intuited was working. Because it is, and because these things are engaging, and like you're saying, it does so many things that are so fun and engaging for the kids that it doesn't feel like therapy. When I'm beatboxing with kids, it doesn't feel like they're going to therapy for that, and yet there are all these really important parts of the sound mind that you mentioned, like the better processing of harmonics, for example, which helps them distinguish syllables, which then helps with reading, that are, so powerful and more potent than maybe a decontextualized flashcard exercise. So, I would definitely, I think music is amazing. It's an amazing tool, underutilized.
And people should know that there are hundreds of studies and books written about music and language and music and learning. There's so much evidence, and I think people trip all over themselves, and the whole, now people are holding clinical studies to, double-blind controlled studies, and that's not. There is so much that it's impossible, really. I mean, music has so many components that drawing from the evidence of many smaller studies, double-blind studies, randomized, that works when you're looking at drugs,
Right.
But it's a very fine model, but it's not one to be it's just not a standard in my mind, when there is so much evidence showing that there are very clear converging evidence from just like there isn't a one single double-blind study that tells us that it's good for our health to eat a balanced diet.
Right.
But there have been many converging evidence studies, and we kind of have learned that in fact eating balanced diet is good for our health, and we know that making music is really good for language and learning. And I really, speech pathologists are in a position to actually do something, which is the important thing. I'm just blabbing, you guys can do something.
Well, thank you so much. And it does feel like, in this world today, we mentioned this before, but there's kind of this attack on intuition. And, I feel like there are people who, oh, there's no double-blind study for balanced diets. I'm not eating one. It seems increasingly like we're moving in that direction. I just, encourage people to get back in touch with that.
Let me just give you one little example, which is, if you go to a conference on aging, which I've done, everything that you can measure gets worse with age. How do you measure wisdom?
Yeah. It's a mic drop. I think that's a fantastic place to stop and maybe leave it open for some questions. And thank you for your wisdom and your knowledge and sharing this with this. Have been a couple. So anyone that has a question, I'll open it up. But there was one about if there's a difference. This from Lauren. Is there a difference according to age? For example, would you say that young children have the most to gain from music as a therapeutic approach?
It's for everyone, honestly. There are different things that happen across our lifetime, and we learn differently. But music is something that can help anyone at any time. I mean, Jimi Hendrix didn't pick up a guitar until he was 12.
Yeah. Yeah. And yeah, Julianne says, thank you so much, Nina. Music is always in my therapy, especially with my students that have significant developmental delays. And there's positive, impressive results. So awesome. I love to hear that. Well, I have maybe an important question. It's a music question. If you could take 5 albums with you on a desert island, which would they be? I've been trying to ask my guests this.
Oh man, but I think I'm gonna tell you what I tell my students. It depends.
Okay,
Yeah.
got it. That's a
What,
good answer.
what kind of mood am I in? And I mean, my music is, I play some, I mean, so at the airlines, for my frequent flyers, you guys like, so if you can masquerade as me when they ask what is your favorite music genre. Again, this is a computer that is making me choose, and I don't really have a favorite one, but what I put in is metal. So I really, I love. You ever listen to Dream Evil or Dokken? I mean, even Judas Priest.
Of course, yeah.
Anyway, but and I play I improvise on piano with kind of rock and jazz, and I play classical
Awesome.
music, and I one of my favorite concerti is one is a Chopin concerto played. I think it's the F sharp one piano concerto played by Arthur Rubinstein, which is just divine. So
Music is divine.
there's
Absolutely.
so much good. It's kind of like food again, like there's I don't really care about the genre, and I don't care about the genre of food. It just has to be good.
As long as it's not on an airplane and it's good. Yeah. We have a question about the beams hypothesis. If you
Yeah,
can maybe just run through it really quickly one
sure,
more
I
time.
can. And please, I mean, it's just 400 words, and it has a picture. So download it from Hearing Research, and I'm sure Garrett will put up the
I
link.
will find it right here.
But so the B, so this is kind of like Sesame Street. C is for cookie, is good. So B is for brain. E is for efferent. So the efferent system is the system that goes from brain to ear and all in between. It kind of informs us. It's a very malleable system. It's a system that is flexible. It changes as we learn. And that's our efferent system. And you should know that our efferent system is much more massive than the A, so that's the A in beams, than the afferent system, which is the ear to brain system, which is the one that gets all the lecture hall publicity, because everybody's always talking about the ear to brain connection, but actually the more evolved an organism is, the greater the efferent system is, because this is our very much involved in our learning. So BEAM is memory, because our experience with sound makes us us. And what are we if not our memories? So M and S is sound.
Beautiful. Thank you so much. And we're getting some nice messages coming in. Thank you so much for sharing this information. I believe music does make a difference in learning. Have some thank yous. And thank you from me as well. You're incredible, and your love of sound and language and music and the brain is just so contagious and evident. And thank you for sharing that with us, that joy with us. Any last remarks or conclusions you'd like to leave us with?
I would like to recommend another book. So Renee Fleming, who is a musician, and she has been very influential in developing the science of music in the mind. She has just come out with a book called Music and Mind, and it's worth reading.
In the chat.
You've got speech pathologists in there. You've got musicians like Yo-Yo Ma. You've got scientists. You've got all kinds of people, all looking at music and the mind. And she does a really good job. So
fabulous. Thank you again. I put that in the chat.
Thank you for having me, Garrett. Thank you. And listen, you all out there, I don't know if there are 2 of you or 20,000, but however, if it's just one of you, you are the ambassadors. You are the ambassadors. You are our future. It's in your hands. Bring music to the people.
Yeah, thank you again. We have a bunch of people tuning in just to say that they really appreciate you. And
I have one other thing I do want to say.
Yes.
And that is, I want to get on my hands and knees. This is a plea. So 100% of the work that we do at BrainVolts is supported by outside, donations, philanthropy, grants. My salary is paid because I'm tenured, but everything else, all the equipment, all the people who make the work happen come from other sources. And if you or anyone who can help us, you can donate to our laboratory. There's a nice donate button that you can push, and we would really appreciate your help, because we spend so much time writing grants that we could be doing, better work with. So thank you.
Well, I certainly will. And any other SLP stuff that you ever need or you need some extra support with, I would be, honored to, help out in any way that I can.
Thanks for making the bridge.
Position.
Thanks
of course.
Yeah.
Okay.
Thank you.
Bye-bye. Take care.
Bye-bye.